You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. And we're talking about laser therapy. With us, we have an expert on the topic. She is the go-to person in the desert when you want to look years younger without surgery. It's Adrienne Bloom. Welcome to the program.
Thank you, Randy. Thanks for having me.
Now, we've had you on the program before.
We have.
And we were talking off camera. I said, what's changed? I mean, you have a lot of experience now.
I do. I
mean, you're booked.
I am about a month and a half right now.
Okay, so for people that are just tuning in and don't know you, you work with plastic surgeon Dr. Mo Zachary.
Right.
And what is your role there?
I'm an RN. I do all of the laser work. People come to me with melasma, brown spots, hyperpigmentation, rosacea, acne scarring, and we customize a treatment for them to correct those ailments of the skin.
Now, for people that don't know the Cosmetic Surgery Institute, you guys do everything there. Is that right?
We do. It's a one-stop shop. You come in, we have medical estheticians, we have fillers. Peggy's wonderful. She's our injector nurse.
Yeah.
And then we also have Dr. Zachary, who does all of the surgeries. We do mommy makeovers, facelifts, tummy tucks, you name it.
And therapy's hot right now.
And therapy is the newest thing that we have there in the office, and it's very hot.
I'm going to interview Danielle about that. I mean, lifting? You're seeing lifting?
Lifting, tightening, and she'll explain it better than I can.
Okay.
But
the results are great.
The results have been outstanding.
Okay, good. So moving on to lasers, which is, are they fractionated lasers? Do you have all the new technology?
A little bit of everything.
Okay.
I have fractionated lasers, and then I also have broadband light. I have two different avenues that we can take with lasers. Now the technology has gotten so much better, we don't have to use just one modality anymore. We can do a variety of different treatments and kind of really customize it now to your specific needs and lifestyle.
So let's begin with who should take advantage of laser therapy? I mean, who's the ideal candidate?
Anyone who wants to make their skin look better.
Okay.
A common complaint that I hear is the saggy eyes, loving to uplift the skin around the eyes, the superficial lines above the lip that I have a picture of. I'll show you later in the show. Melasma is a huge one. Sun damage, living in the desert. If you have speckles on the skin and just years of overexposure, back in the day, a lot of women didn't use, and men, didn't use sunscreen. They would put the iodine on the face and lay out with the foil. We're seeing a lot of the sun damage now. And to correct that is huge in the office.
So as far as downtime, so I get this correct. So depending on how much downtime they want, is depending on the results?
Not anymore.
Okay.
It used to be like that. Back in the day, we would do one really aggressive treatment to really peel and resurface the skin. Now I can do different treatments, piggyback them together. So we're using a less invasive laser.
Okay.
And less invasive settings, and then putting them together so you're getting a great treatment without the downtime.
So you brought some photos, and so what are we looking at?
This is a typical patient. She's 40 plus. She
Let's
has
take a
some
look.
sun damage. And I want you to really notice around her mouth, the lines. That's a real common complaint. And a lot of women come to me worrying that they want to get rid of the lines, but they don't want a real plumped up look to their skin. They're worried that it's going to change the shape of their mouth. It's going to change the way they smile. It's just going to change something about the look, and they're fearful of that. So what I always say to that is do laser. What we can do is we can really get around the mouth. Look at this profile shot. I want you to look around the mouth and notice the texture of the skin. Very common complaint. It's that orange peel look to the skin. That can be easily treated with a laser.
All right.
With a single pass, easy treatment, can really tighten and renew and brighten the skin. Now look at the before, and now look at the after. I want you to see the skin, how bright it is. The pores have diminished, and really look around the mouth. That's where we have all of our expression, and it's a very common place that we have damage and aging through the years. So in her case, she's very happy with the results. She is more vibrant. She has a bigger smile when she comes in, and her husband is thrilled with the results too. Now look at the profile and look at the profile in the before.
All right.
The before, again, crepiness, those lines, the vertical lines on the sides of the cheeks, the redness, the little broken capillaries. She had a bit of rosacea in the skin too. That was all treated. Now look at the after.
Mm-hmm.
It's brighter, it's tighter, and just more renewed. And the lines are gone. Another one I want to talk about is a younger patient.
That's a younger patient. She looks like she has pretty good skin.
Yeah, but she doesn't like it.
Okay.
And that's what matters.
Like when you see this, what do you see?
A lot of people, when I see that, I see sun damage, I see broken capillaries around the nose that we can improve on. There's really no definitive endpoint with lasers, and we can always improve the skin.
Okay.
Now, you look at her and you think, oh, she's young, she has good skin. And you look at the after picture, and you can really see the difference here.
Wow, I mean, that's a great result.
It's a noticeable improvement. Brighter skin, still looks natural, she has a glow, it's just vibrant, youthful, and beautiful.
Now these lasers,
even complected.
These lasers, they heat the underlying tissue and they make you build collagen.
Right.
Is that right?
Right. And let's talk about collagen.
Okay.
Collagen is a protein in our skin, and we're born with a lot of it. It's a key structural component in our skin.
Mm-hmm.
Now, it can get damaged. And unfortunately, as we age, our bodies don't produce it as much anymore. So what we need the help of outside
The laser.
lasers, right?
Okay.
Lasers help with that. So what we're doing, and I always like to use the analogy of a mattress and a sheet, is we want to treat the sheets of the bed with laser peels, with some type of light therapy to help with sun damage, reds, browns, and then we want to treat the mattress and get the structural components and stimulate that collagen to start producing again.
That's what a laser does.
That's what a laser does.
What have you seen? I mean, you told me in the green room that you've seen people transform just because they have
Absolutely.
better skin.
Absolutely. I had one woman come to me. And, she walked in the door. Her eyes rarely met mine when we talked in the consultation. Her self-esteem wasn't the greatest. She wanted to just renew and rejuvenate her skin. She said her whole life she never had that peaches and cream complexion. So we decided to do a laser peel, a light laser peel. About 2 to 3 weeks later, she came into the office, head up high, smiling ear to ear. The girls all commented on how great she looks and how happy she is, and she was just really glowing. And she pulled me aside and said, Adrienne, I just have to tell you something. When I got home the other day from shopping, my husband looked at me and said I was beautiful. He's never told me before that I was beautiful. And that's what makes my job. It doesn't get better than that.
So do you believe, by the way, that you can take a 50-year-old and give them 5, 8, 10 years younger?
Absolutely.
With some of the laser therapy?
Absolutely.
Really?
Absolutely. You take years off. And what's great, you take the years off, and then in 10 years, they still look better than they did 5 years before. So it's just a gradual approach to aging. And that's really big now, is we want gradual, we don't want somebody to look and be like, oh God, what has she done?
Yeah.
And I hear that a lot
You don't
from
look
people.
done, by the way,
Thank
which
you.
is nice.
Thanks.
Okay.
I like the less is more approach.
What do you mean by that?
Less is more. Sometimes underdoing it and being very natural looks more beautiful, more youthful, more invigorating to the skin. I mean, you're a man, you know. What do you feel looks good?
Well, I mean, I could tell when women look done, they look done. It doesn't look good. Nobody wants that unnatural look, do they?
Nobody wants to see what you've done. You just want a refreshed look. And I hear that a lot from people. They said, my friends all say I look great. Did I get rest? Did I sleep in? What are you doing? But they can't pinpoint it exactly to what really.
So, I know your age. I mean, you legitimately look 10 years younger than your age. How long do you think you could keep this look? Because you're taking advantage of everything that, laser therapy has to offer.
Right.
And technology.
Right. I think I can maintain this look next 10, 15 years.
Is that right? And you could do that for your patients?
Absolutely. Why not? Why not? It doesn't matter what age. And you don't have to fix something if it's not broken yet. Come in your 20s, in your 30s. Start now. Skincare is so important. And don't be afraid with lasers. I have a new treatment. It's called a laser infusion therapy. I'm also an esthetician as well as an RN. So I wanted to fuse the best parts of a skin treatment with the best parts of a laser treatment and give you really an overall perfect treatment for the skin.
Okay.
It starts off with exfoliation, and then we do some hydration and laser, but it's a great way to introduce your skin to lasers. There's no downtime. The skin looks bright, fresh, clean. Afterwards, the pores are smaller, the lines are less visible. It's just a great treatment.
Can somebody go in on a Friday, get a laser treatment, go over the whole face, and go back to work on Monday?
I call it show up Friday, show off Monday. And with this specific treatment that I was talking about, your skin that night. I've had women come in who have an event that night to go to. We live in a very seasonal community, and the last thing some women want during season with all of these events is having skin that they need to heal from and stay indoors for 2 or 3 weeks. Okay. So treatments like this are great for those women. It maintains the skin, and we want to keep the skin in shape.
Final message. Somebody watching this show, they don't like the way they're aging. And we also didn't mention men, because you help men too.
Right? And I do want to talk about men. Common complaints are broken blood vessels and acne scarring. We can treat that too. So women, if you're watching, your husbands can come in, we'll get the treatment done. And also any age in the lifespan, from your 20s.
How early do you want them coming in?
Well, if however long they when they want to start making their skin look better.
Okay.
20s, 30s, I would love 20s. That way I could start working on it and really start rejuvenating that skin. But typically 30s, even early 40s, coming in and starting to freshen up so they don't have that dull look. You just have young, sexy, vibrant, beautiful skin that when you walk into the room, everybody notices.
Everybody says, "Oh my goodness, what'd you do to your skin?"
And yeah, I think skin is so important. Skin and a great smile are two things that everyone notices, and you'll feel better about yourself. And we just want to open up that door and have you come in, and don't be scared of lasers. I know there's a lot
Are there people scared of lasers?
Yes, they think that they're going to have that white waxy look, and I hear that a lot.
I see these shiny
yes
wax looks.
Yeah. And
is that the lasers of the old days?
Old days. Those were the phenol peels, the old lasers that were really aggressive and hurt those melanocytes, those pigment cells in the skin. Now we don't have to do that anymore. The technology is better. We can use different lasers at once to give you a less invasive procedure, but you will not have that white waxy look. Instead, you're just going to be a better version of yourself.
Natural looking, young
natural
looking. Because you don't have that look.
Thank you. And I do lots of lasers. I do quite a few, yourself. Let me tell you.
You laser, is it like a selfie? I mean, you have to hold your arm out?
I do. I've gotten pretty good at it too. I put the mirror in front of me and...
we talked about something where people blur their selfies or blur their photos on Facebook.
Right.
Now you don't have to do that anymore.
You don't have to do that. You come in, you have laser, and you don't even have to put makeup on. I hear that a lot from women. I don't have to wear makeup anymore. All these years, I've always had to cake on the makeup in the morning before I go out. Now I don't have to do that. My skin is, and my husband loves it. Men don't like a lot of makeup on the skin. And when you don't have to wear it anymore, it's just a really beautiful look, I think, the way the skin looks with just a real natural approach.
Do you think there's an art to this? I mean, the machine doesn't do all the work, you say.
Right. No, there's lots of settings that we have to do. There's different modalities that we have to use. There's just a lot that goes into it. And having my background as an esthetician, I get skin. I understand it.
You have an advantage.
I have an advantage.
You're the best RN in the desert because of that.
Thank you.
Do you secretly think that?
No, of course not.
Okay,
of course not.
But you know how to push these machines. That's what Dr. Zachary said. She knows how to push the machine.
I
to
do.
Get the maximum results.
Absolutely. I've gotten it to a level now where I see the skin, I see what I need to target, and we achieve our goals.
Good. Have you lasered Dr. Zachary?
I have.
You have?
I have.
No wonder he looks so good. He said he's just eating better and wearing sunblock, so he's lasered.
He's lasered
Interesting.
too. Everyone is lasered.
I want to thank you for coming to the show.
Thank you,
stuff.
Randy.
We're out of time. We could have you on all day, but it's very good.
Thank
You've been watching The
Pleasure.
Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. How to look years younger without surgery, according to my next guest here. She is the lead esthetician at the Cosmetic Surgery Institute of Palm Desert. We've had her on the program before. She's booked out. She is, I mean, and I'm not trying to endorse her, she is the go-to esthetician in the desert. Marisa Rivera, welcome to the program.
Thank you. Nice to see you again.
Now, you've been there, and I know your age. You also look about 10 years younger than your age. You've been there a long time.
Yeah, 9 years, over 9 years.
9 years.
It's a wonderful place to be.
Now, they call you like a medical grade esthetician.
Yeah, we work under a doctor, so we have access to, you know, the latest and greatest pharmaceutical grade ingredients, treatments.
So micro needling or the MicroPen.
Mm-hmm.
Pen or pin? Pen?
Pen.
MicroPen.
Yes.
I think you told me I need this.
This is such
Do
an
I need
awesome
this?
treatment.
Everybody
I
needs
actually
this?
I'm obsessed with this treatment.
Really?
Yeah. It started about a year and a half ago, and I have a patient who lives in New York. And she was coming to see me when she was down in the desert. And every time I saw her, her skin just kept looking a little bit better. I said, "What are you doing?" She said, "I'm doing this pen treatment. It's called the MicroPen, and I'm doing it in New York, downtown Manhattan. It's the newest thing. You have to get this." So finally, we were able to get it, and I'm really excited about it. This patient actually had a lot of scarring here from chickenpox years and years ago when she was a child, and it just had a lot of pitting, her fine lines. It has completely smoothed her skin out. It is smoother, it's
With
softer.
this MicroPen.
Yes, and people are commenting on her skin now.
So people love this.
Yeah.
I have a buddy, heads up the plastic program at UCLA.
Mm-hmm.
And I was at a holiday party. He couldn't stop talking about it.
Yeah.
He was the guy to avoid at the party because all he wanted to talk about was this MicroPen.
And it's great.
I'm always skeptical,
Yeah.
but does it give results?
It does.
Because I think an esthetician doing it, can
It
they
does.
really get
and
big
I
results?
do not offer anything at our office that doesn't work and that I don't believe in, truly. This is a non-invasive treatment. So you look like you have a sunburn.
How does it work?
Okay, so it actually looks like a pen, hence the word MicroPen. On the end of the pen are little needles. And what we do is we put hyaluronic acid on the skin, which is like a topical hydrating serum for the skin. We needle over the face. Now, it sounds scary, I know, but it's not. We numb your face before you don't even feel it. And
So, I mean, that's the advantage, of course, working with
Yes.
Dr. Mo Zachary. So you have the numbing stuff.
yes, we have awesome numbing stuff that we use for all of our lasers, for our fillers, Botox, everything. It's a great numbing treatment. You come in 15 minutes before, you numb, then you come to see me. We dermaplane your skin
Okay.
prior, which takes off all that dead skin, and then we needle over. And honestly, it's
So
a
these
great
little
treatment.
needles, like it's a bunch of little needles or
Yes,
one needle?
they move. It's actually 12, and they move up and down.
Like poking into the skin?
Yes, I know. It sounds scary, but it's not at all. And you can talk to any patient that comes to see me, and afterwards they go, "That wasn't bad at all." It's not scary. And what it does is as those needles are moving up and down, it's pushing the hyaluronic acid into the skin, and it's creating almost like micro injuries so that your skin is starting to stimulate that collagen synthesis. And I once took a class that said, in order to make your skin look better, you need to injure it. And that's
Makes
why
sense.
we do the lasers and, you know,
So the needle goes in and the body is responding with maybe a
Yes.
little bit of collagen.
collagen. Mm-hmm.
Interesting.
You can work, you can adjust the depth of the needle. So you can work deeper on lines, you know, deeper lines, acne scarring.
What about under the eye crepiness?
Yes. In fact, I have a picture that really shows how great the MicroPen works. And this is a woman who...
This is not your patient?
This is not my
Okay.
patient, no. This is what we find in the desert. And it's deep lines around the eyes. And we can even do Botox there, but sometimes those, you know, that crepiness is still apparent. So typically with this crepiness, we have to treat it with a deep resurfacing laser, Botox. You know, of course, we're trying to use the best eye creams. But with the MicroPen, what the company, with this photo that the company gave us, shows this woman has less lines and wrinkles. The skin looks a lot smoother. And I have actually seen this with my own patients. I actually, last week, did a treatment on one of my clients who had a very deep set line right here from sleeping.
You sent me that photo, by the way.
Yeah, it is a great photo. 6 days later, I saw this woman and she said, "Oh my gosh, Marisa, my husband noticed this." And I said, "He did?" And I even looked at it. I was like, "Oh my gosh, that looks amazing." I was even
You were taken
almost
back, really.
surprised at how good it looks 6 days. So one thing with this treatment, it's not a one-time thing.
So like those, but with that one lady, she had these creases on her face.
Yeah.
You get from like sleeping on your face or whatever.
Or, you know, it just...
And the micro needling, you just go up and down on it.
We move in circles. We kind of cross-hatch where we go across it, and then we do the whole face. So I get that comment a lot. Well, I have this, you know, a couple lines that really bother me. I said, do the whole face, because we're stimulating collagen. We're stimulating that elastin. So your skin's going to look more radiant and healthier.
So
That's
everybody
my goal.
should do that. I mean, this is part of now.
Totally. I mean, I
To look
recommend
younger,
it.
this is what you have to do.
Yes, and all ages. You know, it can help your skin look healthier. It slows down that aging process, and
Have you had it done?
I have.
Your
yeah.
skin looks really good.
Thank you. Yeah,
Did you microneedle yourself?
No, but our other esthetician Danielle did.
Oh, she did?
Yes. Yeah, we
Okay.
do a lot of things on ourselves too, because we're so busy. We don't have the time to get a lot of treatments. But this is just...
I mean, is this your new favorite procedure?
It is.
I know you
love
guys
it.
all like Ultherapy.
We love
but
the
you
Ultherapy.
love this needling.
Yeah, they all go hand in hand. And that's what I love so much about what we do. And this industry is just growing. You know, it's not all about going in and having a facelift, even though that can give amazing results.
Dr. Mo Zachary said it on
Yes.
my show. He said, Randy, I didn't believe it, but I'm seeing it. He goes, we can postpone surgery
Definitely.
if
yeah.
they come in early enough.
If they do an Ultherapy and they do a laser and maybe throw in some MicroPen treatments, take 10 years off for sure.
Do you see changes in self-esteem?
Yeah, I do. One comment I got from a patient of mine who had acne is she said, God, I'm not taking on the makeup anymore. You know, and I'd sit there and kind of press all that makeup onto my skin. I'm not doing that anymore. So, and another thing, Randy, is when you feel good about yourself, it completely changes you. You walk into somewhere, you feel more confident, you're smiling, your attitude is better.
But it doesn't have to be expensive
No,
to have great skin.
no. And this MicroPen treatment is a good price. Again, recommended to do a series of 3, and then interchange that with BBL treatments and just getting your regular monthly facials. You know, women, men, any age, it's
I have been
helpful.
told this. I have been told this. But it was by Dr. Mo Zachary. But he said, Randy, my estheticians are, well, he thinks you guys are the best. But he says they're the busiest in the desert.
We are so busy. I mean,
I mean, you have regulars, right?
we have regulars that come in every month.
You're
I mean,
almost like Botox, I heard. That it's like, once you get Botox, you're stuck doing it forever.
Yes.
Once they go to the estheticians there, they're
Yeah.
stuck going to you guys forever.
yeah, and
Is
we
that
become
true?
well.
That's
And
what Mo said.
it's a relationship too. You know, it's like you become friends with. They know all about my kids. That's so much part of it, and also the end result. So, you know, in the years that I've been there, I've had women, men coming to me for 9 years.
Really?
9 years. That's a long time. They've seen me have 2 kids. You know, but it's not all about just the relationship. It's the results. And then they get really excited when I say, ooh, I have a new treatment. It's the MicroPen. Oh, tell me about it. And then they book. Okay, I'm booking. And then they have their friends. You know, well, I'm the guinea pig. I'm going to, try it out first. And then the friends, come in after.
Men? Are
So-
men doing this?
Yeah.
Real men?
Real men. You could do it.
I need to go in there. Do you have a celebrity backdoor entrance for people like me?
We could. We actually have had that happen before.
Do you have celebrities that are going there now?
Yeah. Yeah.
I know that you guys have a celebrity following over there.
Yeah.
So this MicroPen
Uh-huh.
is the way to go. And what else is new? What else is hot?
Hot, the dermaplaning still is our claim to fame, I think, at our office. This was just featured on Good Morning America. It was a great piece on it last week.
The pen we're talking about?
No, actually the dermaplaning.
Okay.
And this is a little tool that takes off all the dead skin, takes off the hairs on the face. Women love that. This continues to be a hot treatment, and I really believe that we're the best at doing it.
So you love this procedure.
Mhm.
And by the way, you've been on my show before.
Yes.
Did people ever see you? I mean, do you ever get recognized out and about?
I don't know.
But your patients
Maybe.
see you.
Patients see us. They love it. They go, "Oh, we saw you on TV." Yeah.
Yeah, good. Well, I'm glad, and I wish people could see this. The desert doesn't support HD, but your skin is so good.
Thank you.
And I'm not trying to be here just telling people to go to you, but I think that's important. If you're going to go to an esthetician, you better make sure they have good skin.
Yeah, I mean, it's like going to, work out with someone. You want to, if you see they have a really, they're toned and they look good, it's like, okay, I want to look like her, and the skin is kind of the same thing. It's like a workout. If you're going and you want to lose weight and you want to eat healthy, it's the same thing with your skin. You come in once a month or every 6 weeks. It's like a workout for your skin over time.
What if you're in your 60s or 70s, which is very young these days in the desert? What do you say to that woman that says, well, I've never really been to an esthetician?
I get that all the time, actually. I get women that...
Like first timers.
Oh, yeah. In their 60s, 70s, and they say, oh, I don't know if it's too late. It's not. Because of all the technology that we have now, between the lasers, again, the old therapy, it's not like so... you do this or you do that. There's so many things that, are wrapped up into one. And it can make a big difference no matter what age you are.
Have you done any of this MicroPen on Dr. Mo Zachary?
I have not. No, we have to do that.
Is that next for him?
He's so busy. I'm so busy. We have to get him in.
Because he looks great right now.
Yeah.
But I heard he had some laser.
He's done laser. He's done the old therapy. So he's next for the MicroPen.
Wow. Well, good.
Yeah.
Well, look, we're out of time. I want to thank you for coming
Thank
on the show. And if somebody wants to schedule with you, they just call the office.
They can call in and just ask to, come in and see one of the estheticians for the MicroPen treatment. So.
Okay, great. Thanks for coming in.
Thank you.
Great stuff.
Thank
You've been
you.
watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.